We have no financial disclosures to make. Plaque brachytherapy is a commonly performed intervention for intraocular malignancies in situations where the tumor is located in the anterior segment. The plaque is positioned over cornea and sclera. When the lesion is located in the medial, lateral, or inferior iris, positioning of the plaque becomes quite challenging. Even though the eyes of the plaques are sutured, there is always a potential of the plaque getting displaced. Reasons for difficulty includes gravitational pull, which tends to move the plaque from its position. This can lead to inadequate dose of radiation delivery to the tumor and overexposure of radiation to the normal tissues. The eyeball, being a mobile structure, keeps on moving. This leads to rubbing of the plaque against the ocular surface and can lead to displacement of the plaque and damage to ocular surface. There are reports in literature where a Gunderson flap has been used to cover the posterior surface of the plaque. However, there are no studies or reports which mentions the use of additional sutures. The authors suggest a simple triple support pocket technique for anti-segment tumors.
The first step involves sectoral peritomy with conjunctival dissection. Step 2 involves first placement of the plaque along with placement of figure 8 ethibond sutures over the plaque as first layer of support. The third step involves advancement of the conjunctiva over the plaque, and the fourth step is basically performing a suture tarsography.
Moving on to surgical demonstration, a 42-year-old female presented with a pigmented lesion in her right eye. Certainnovel examination revealed a pigmented lesion involving the inferior aspect of the iris extending from 6 o'clock to 7 o'clock. UBM revealed a 3.86 into 7.32 mm iridocerebral lesion. Contrast enhanced MRI revealed an iridocerebral lesion which was hyperintense on T1 and hypo on T2. As the patient refused to undergo a fine needle aspiration biopsy for diagnosis, we used the ABCDEF guide by Shield et al. To come to a diagnosis. The ABCDEF guide includes A stands for age less than 40 years, B stands for blood, C stands for inferior clock hours involvement, D stands for diffuse configuration, E stands for ectropion, and F stands for feathery margins. In our case, we noted
the presence of 3 positive features. A diagnosis of right eye inferior iridocerebral melanoma was made. Systemic evaluation was performed to rule out metastasis. The patient was planned for plaque brachytherapy using radioactive ruthenium-106. These are the plaque details. We also took into account the thickness of BCL, and it was ensured that the plaque covers the lesion in all sides at least 2 mm, and the center of the plaque should lie at the maximum apical height of the lesion. Moving on to surgical steps. First, a localized limbal peritomy was made. Small conjunctival flap was then fashioned. A dummy plaque was then placed. Through the eyes of the dummy plaque, sclera was marked. 50 ethibond sutures were then passed through the marked sclera. Radioactive plaque was then placed and sutures were passed through its eyelids. First layer of support was placed using 50 ethibond sutures in figure of 8 fashion. A bandage contact lens was then sandwiched between the cornea and the plaque.
to avoid rubbing of the plaque against the cornea.
Then second layer of support was placed by advancing the conjunctiva over the plaque. A suture tarsography was then performed as the third step.
Within 48 hours, the tarsography was removed. The plaque was noted to be in position with no obvious tilt or displacement,
and there was no corneal epithelial defect or edema.
To conclude, triple support pocket orientation helps in avoiding displacement of brachytherapy plaque.